Many offices are struggling today and eternally with a high number of cancellation and no-shows. In fact, I would go as far as to say for many dental practices, there's an epidemic of cancellations and no-shows. Now, they can happen for a lot of different reasons. But I'm going to suggest a fix here, a way to correct that. And this might be the missing ingredient that can change that for your practice. Sometime toward the end of your first visit, the new patient experience, I'd like someone on your team to sit down with the patient and say something like this. Naren, first of all, it's so nice to meet you today. I'm so thrilled that you chose our office for your dental care. We're going to work really hard to provide quality dentistry and make every visit a great experience for you. As an active patient, Naren, can I explain what you can expect from us? And I'm going to nod my head up and down, and that's neurolinguistic programming. When I nod my head up and down, what's the patient going to do right along with me?
They're going to do the same thing. They're going to
do the same thing. So, Naren, you can expect 4 things from us as an active patient. Number one, we think of our patients as our patient family because we want to take care of you the way we'd like to be taken care of ourselves, clinically and behaviorally. And because of that, number 2, you can expect us to use the highest quality materials, the latest technology, the latest advances in dentistry, because that's what we would want if we were a patient. Number 3, we stand behind our work. We actually have a written warranty. If anything doesn't meet our standard, we redo it until it does. If any treatment is recommended, I'll go over that warranty with you. But for now, just understand that we stand behind our work. Number 4, we've developed a protocol for you to be able to reach our doctors after hours if you ever have a dental emergency. And we have a little printed card and we hand it to them. We say, keep this in your purse or wallet and keep it handy if you ever have a dental concern after hours. Now, if it's a routine type question, you can just call the office, leave a message. But if in fact you'd like to be able to reach out to the doctor, here's the protocol for doing that. So I've given 4 things. And now I say, Naren, now that I've shared what you can expect from us, can I take a minute and explain what we expect from you? And I nod my head. And what does the patient do? They say, sure.
Absolutely.
Naren, it's just one thing. We expect that if you make an appointment, you actually show up for that appointment. Now, we fully understand that sometimes life throws us curveballs and sometimes things happen. In fact, I saw a bumper sticker the other day that said things happen. Well, the first word wasn't things, but I think you get the idea. Stuff does happen. And there we understand that. And when stuff happens, all we ask is that you kindly give us 48 hours advance notice. Does that sound fair to you?
That's very fair.
So notice what I did. It's very psychological. I've given Naren 4 things. I'm only asked for 1 thing in return. Could that be the missing ingredient in your practice, doctor, from experiencing an epidemic of cancellation and no-shows versus having it much better under control? Let our patients know what's expected of them. Now, I'm not going to tell you that's going to work 100% of the time, but I flat out know it works. We teach this to our clients. And my clients tell me, Gary, when we send out the confirmation reminders for hygiene, for our good patients, we send out the first notice 7 days in advance, a reminder. We'll get some calls from patients that say, oh, I got the reminder today, and I don't know what I was thinking when I scheduled that appointment. Next week, my crazy cousin's getting married. I'm in the wedding. I don't know what I was thinking. I need to reschedule that appointment, and I know I need to give you at least 48 hours notice. And now they're calling a week in advance. See how that works now? That tells me that it got ingrained in their mind that they're expected to give 40. All I really want, first of all, I'd love them to show up for all their appointments. But if they don't, what I really want them to do is give us 48 hours. Because the likelihood that I can fill that appointment in 48 hours in hygiene is actually very high. Could that be the missing ingredient for you? I'm going to suggest maybe it could.